I'm here. I think I'm here.
Okay. I'm not exactly sure how to word this other than to tell you that I have a position back home as a resident counselor, and I'm responsible to 3 schizophrenics, or labeled schizophrenics. And having heard your talk and the others speak, and I myself am in training, getting ready to finish up my master's, and am interested in psychiatry and interested to go back and study that field, and hopefully understand some of the problems that these people I'm involved with are going through, or whatever they're going through. And I just need some advice from you as to what kind of training I should look for, how I can better prepare myself to understand these people, or understand psychiatric views or psychological views on these problems. Understand I might not be able to get your books, but if I could, I'd like to. Whatever, just...
You don't need my books.
Okay.
But you are making that's a very sweet question, but there's a presumption in it which illustrates what a nice person you are. But I will have to disappoint you. Because you may be very nice, but the world isn't quite that nice. You are assuming that by understanding more about these things, you'll be able to be a better psychiatrist. You won't be able to be a psychiatrist at all. By understanding the inner life of blacks, you won't be a better slaveholder.
Pardon me? What was that?
By understanding the inner life of slaves, you won't be able to be a better slaveholder or slave master. If you want to understand the inner life of mental patients, there is a method which is much older. It was discovered long before I was born. It's biographies, or even better, autobiographies of great people who have had mental turmoil and who usually late in life wrote books about this. One of my favorites is, who happens to be also one of my favorite political figures, is John Stuart Mill. John Stuart Mill has a little known book called The Autobiography of John Stuart Mill. I see one head nodding. How many people have read that book in this book? Well, nice audience. You could certainly go to your medical school, and I'm sure nobody even ever heard of John Stuart Mill, much less his autobiography. Now read the autobiography of John Stuart Mill. Read Shakespeare, read the great literature, read the Bible. Read history. That's how you find out. Or talk to people and see what they want. Now you could talk to those schizophrenics. You see, your problem, you will have a problem, because at some point your so-called patients may express some desires in their life which, if you facilitate, you will be in conflict with your own employers. And I have nothing to say about that, except it's not a good idea to get into that situation.
So you see.
Now let me make another point, you see, which is very sweet to my heart. Maybe I should stop on the... Well, no, I can go on. My voice seems to be getting better as when I talk. See, now I'm going to tell you something which is so simple, which is my favorite thought. Probably not very original. Nothing about life is. I have always been very interested in science. In real science, but you know what I mean by science, physics, chemistry. Now, in real science, it is perfectly obvious that knowledge and control go hand in hand. In order to control, let's say, atoms, molecules, drugs, you have to have knowledge. The more knowledge you have of them, agriculture, fertilizers, the more you can control. Okay? In human relations, it seems to me, it's exactly the other way around. The more knowledge you have of another human being, the more paralyzed you are. Why would you want to... The only way to control somebody is if you don't know him at all. He's a strange enemy. You are flying 50,000 feet and dropping a bomb. You don't know him at all. Then you can control him. The more you know another human being, the more paralyzed you become. If you are a human being yourself. And this is why in the history of psychotherapy, if you take people like, my 2 favorite figures would be Carl Jung, and even more someone else, a very interesting psychiatrist, who most young psychiatrists don't know he's a psychiatrist, because that in a way has been falsified in the history of psychiatry. He's identified as one of the founders of existentialist philosophy. Karl Jaspers. You know who Karl Jaspers was? No.
No, sir, I sure don't.
You don't?
No.
Well, let me tell you, he was a psychiatrist. And I suggest that you spend a couple of weeks finding out why he gave up psychiatry.
Thanks.